And if you're not a member of the society, I encourage you to consider joining. I have a link on the screen that you can go to. If you'd rather just go to PayPal and do it directly, you can do that. PayPal.me/SHMHP. The membership dues are inexpensive. $15 for an individual, $5 for student membership, and then it goes up from there. Just a few notes for tonight before we get started. Everyone's audio is on mute, except, and I will mute myself when our speaker gets started tonight. And then you'll be able to ask questions at the end through the chat box. You should have a chat box. It may be up in the menu at the top. You may have to do there might be a more button or a more something that you have to click to make the chat box come up, but you should be able to do that at the end. Before we begin, I'd like to highlight, we've started highlighting a couple of our board members each stay-at-home lecture. Tonight, I'd like to highlight Dr. David Davies. He is our current vice president for the society. He's been a longtime member of the society, and he is currently employed in the UAMS College of Medicine, Department of Neurobiology and Developmental Sciences. Dr. Davies is a wonderful board member, wonderful professor, and we all enjoy having him involved with the society. And I also would like to put a spotlight on Dr. Jim Mark Ingram. He is a partner in the Little Rock Allergy and Asthma Clinic. He actually celebrated his 26th anniversary there yesterday. And he is actually one of our newest board members. He was just elected to the board this past March, and we're so glad to have him on board. And I know he'll do a good job, as has Dr. Davies. And so we're so glad to have both of them for their enthusiasm and support on the society board. Now, as I mentioned earlier, I am director of the Historical Research Center. Our mission is to preserve the history of UAMS as well as the history of health sciences in Arkansas. The Historical Research Center is the only archives in the state that's dedicated to preserve the history of medicine and the other health professions in Arkansas. We were established in 1978 and home to all sorts of artifacts dealing with the health professions, as well as rare books, photographs, archival collections. And I'd encourage you to come and visit us sometime. We're not open to the public right now because of the COVID-19 pandemic, but we would love to have you come visit with us, and I'd love to give you a tour. Also, if you have any materials that document the health sciences in Arkansas, we'd love to talk with you about that and perhaps maybe donate them to our collection. Now, I did mention the COVID-19 pandemic that we're experiencing. We do want to document that period in our state's history. So we are in the process of gathering materials, flyers, anything like that, journals that you may keep, diaries, photographs of you, maybe photographs of you in a mask. We'd love to have those and to document this period and to keep in our collection, because researchers 50, 25 years from now will be interested in how we dealt with this pandemic. And just a brief note about upcoming stay-at-home lectures. Our next one is July 16th. We are continuing these every first and third Thursday through September. You see the list of presenters up on your screen. The next presentation is July 16th on Dr. Edith Irby Jones, and that will be presented by Dr. Eric L. Macias from UAMS. So, speaking of that, and this is going to be my last slide before we turn it over to Dr. Taggart. On August 20th, we are having a presentation by Mary Ryan, Bill Russell, and William Lindsay entitled A Family Practice, the Russell Doctors in the Evolving Business of Medicine, 1799 to 1989. That presentation is coming out of their research, which has just been published in book form. Family Practice, I think that's probably backwards for you guys, so you might not be able to read that. But we'd love for you to buy the book. It's discounted right now at the University of Arkansas Press, uapress.com. We'd love for you to buy that, read it before August 20th, ask any questions that you have, and help support the UA Press and the Historical Research Center, because that collection that was used in writing that book is housed in our facility. Now let's move on to our speaker tonight. I'm very pleased to welcome Dr. Sam Taggart to the stay-at-home lecture tonight. Dr. Taggart is actually a member of the Society board. He's been a long-time board member, long-time supporter of the Society. He is a retired family practice doctor, and he is a published author. In 2012, he was commissioned by the Arkansas Times to write a history of healthcare in Arkansas for the last 200 years. And his presentation tonight is on Country Doctors of Arkansas, which came out of another project that he launched in 2016, the Arkansas Physicians Oral History Project, where he went around and did history or interviews of Arkansas country doctors. And he is gathering that materials and putting them into a book form, Country Doctors of Arkansas, which is due to be published in early 2021. So I am pleased to welcome Dr. Sam Taggart. I'm going to mute myself, turn my video off, but Sam, if you need anything, just holler at me.
Make sure. Can you hear me?
I can hear you.
All right, good. Okay. All right. Good evening, and thank you for letting me, for letting me come to this conference. Hold on just a half a second. There's a feedback coming here. The Country Doctors of Arkansas are a hidden treasure. They labor away in relative obscurity in their small communities across the state, and have so for a long time, probably about 10,500 years. Most of the country doctors in rural Arkansas were born and raised in a small town and chose to return there. Each little town has its diverse characters and dramas, and the physician, the country doctor, is often the narrator, the father confessor, the soul who's there for families from birth to death, and the person who they call in time of need. I've had more than a few people, especially spouses of country doctors, tell me over the last few years that their husband or wife was a public utility. That's how they're viewed in many places. There are several traits that are important to a country doctor. And this probably goes for all doctors, but it certainly goes for country doctors. And the first of those is trust. The trust to do the right thing, and the trust to be there when they are needed. And another thing I've heard over the last several years, and I certainly believe this, is a trait is wisdom. That is, that most people in small towns think of their doctor as the best diagnostician ever. He may not have all the equipment, but he's smart enough to figure out what to do and how to get to the people they need to, where they need to be. When poetry and fiction is written about country doctors, it's usually written with an admiring eye. Now, for us to begin to talk about and think about country doctors, it's important that we go back and think about and talk about country people. Thanks to the Arkansas Archaeological Survey in Jonesboro, we now know that there was a group of people who called this place we call Arkansas home 8,500 BCE, or 10,500 years ago. We know this because because Dan Morris and his crew found a cemetery on a sandy bluff overlooking the Cache River between Jonesboro and Walnut Ridge. And they dated that back to 10,500 years. There weren't many people here and there, but they were people. And these people were primarily an encyclopedia of survival. Next slide, Tim. These people were an encyclopedia of survival. They had nobody to take care of them. They had to figure out what to do and how to do it. As the agricultural revolution, the Neolithic revolution continued over a period of millennia, these people began to collect a pharmacopoeia, a collection of drugs that they used in times of need. They also developed a pretty complex set of abilities to do surgical procedures, primarily external surgeries, but the repairing of fractures. There's no evidence from Arkansas, but it's pretty clear that there was good evidence that people did what was called trepanation. And that was to burr a hole in the skull to either let something in or let something out. And interestingly, all the studies of trepanation across the world have shown that many of these skulls where trepanation was performed healed. So the people actually survived the facility. Next slide, please. As the populations increased, as societies became more complex, there was a need for specialization. People to make pots, people to make baskets, people to be leaders. It's out of this impulse of dealing with life and all the thing that goes on with life, like COVID and the afterlife, that the priest physician began to emerge. And the separation between priest and physician didn't really go away very much, and I'm not sure it's gone away completely now, until the scientific revolution 3 or 4 centuries ago. When De Soto arrived in the 16th century, in 1541, what he found was that there were several 100,000 people in the middle Mississippi Valley, the Trans-Mississippi, Arkansas, whatever we call it, that were organized into Mississippian chiefdoms. And these people had a very complex structure with medicine men, shaman, jugglers, whatever name you want to put to them. He also brought with him, he and the African-American slaves that he brought with him, or he and others brought with him, they brought crowd diseases. They brought diseases like smallpox, the flu, measles, and other illnesses like malaria. So that for the 2.5 centuries before the Louisiana Purchase, after he was here, the Native Americans of the North American continent were subjected to an epidemic, mild, sometimes small, sometimes large, every 4 to 6 years of some disease. By the time of the Louisiana Purchase in 1804, there were only about 4,000 people left, 4,000 Native Americans left in what we call Arkansas. There probably were close to 365 trappers and hunters that were primarily European, and about 65 slaves. In the following 60 years, in 1860, when the Civil War started, there were 435,000 people in the state of Arkansas, and there were about 115,000 of those were African American slaves. So you ask, when did the country doctors actually start to survive? Well, the various expeditions that came to Arkansas in that first 250 years would bring somebody with them, but they would leave when they left. Probably the first country doctor in Arkansas was a fellow by the name of Francois Menard, who lived in the town of Nady, Arkansas. Francois practiced for a year or two and then went back to being a merchant. Okay, so come forward. Let's go, Kim, one more slide. One more slide. There we go. That's done. That's good. Back one more, please. Anyway, probably the first real country doctor in Arkansas was a fellow named Peyton Pitman. And he ran a ferry at the point where the Current River crosses the Arkansas border from the Missouri Territory. And he had a sign on the ferry that said, "Welcome to Arkansas." Well, he practiced medicine for 30 or 40 years. He was also the postmaster. He was also the circuit judge at that time. The the early country doctors, as people settled Arkansas, as they increased over that first half of the 19th century, people would set up a camp or a small community at the river crossings, like Davidsonville and Batesville and Conway and Little Rock and Benton, and where Arkadelphia would be. And where two or more people gathered, usually a doctor would show up, or somebody who called himself a doctor. Most of these men, okay, and they were all men at that point in time, were called regular doctors, okay, meaning, or allopathic doctors, meaning they were MD type doctors. There were a very small few of these people who were university trained. One of the first that we can document of university trained physicians was Dr. Matthew Cunningham, who set up in the little tiny outpost of Little Rock, Arkansas in about 1819. And he had been trained by Benjamin Rush. But most of the physicians were apprentice trained physicians. And what they would do is they would apprentice themselves to a practicing physician in another town. And then they would read to medicine. And then eventually the doctor would let them go out with them and see patients. Eventually, many of these, as the century progressed, many of these people would go off and take 2-month courses in medicine at St. Louis, at Lexington, at Louisville, at Nashville, and then they would come back and they would be licensed to practice medicine. They were always encouraged to go to a different town. Okay, Dr. Henry Davis Sadler of Cleveland County relates about a Dr. Stanford in 1846. And he said, the family doctor was a part of the vanguard of those who migrated from the east of the Mississippi River and settled in this part of the country. Those doctors were part and parcel of those who cleared the woods, built the homes, schools, and churches, and laid the foundation for society. They shared the life of the rugged pioneer. In his book, Life in the Leatherwoods, John Quincy Wolfe, talking about a little bit beyond this, but he made the comment about the medical professions in his part of the country. Most of the country doctors in the Leatherwoods in the 1870s were innocent of any contacts with medical colleges. These folks, next slide, please. There were other types of physicians, other types of people practicing healthcare in this time frame. Now, I put 2 slides up here of 2 women who, not technically from the 18th century, but they represents a very important element of that. Ella Dunn was a herbalist, a female herbalist, and a granny midwife. She took care of women who were pregnant. Really, really important. She's from the Ozarks. Caroline Dye was from Newport, Arkansas, and Miss Dye was a voodoo doctor. And these folks, interestingly, there were probably a number of different women who carried the name Caroline Dye, but these women delivered babies. They provided herbal treatments, and they filled gaps when there was no one else there. And sometimes they fill gaps that nobody else wanted to see the other doctors. A couple of interesting points about the early doctors. Let's go next slide, please. Probably interesting points about the early doctors. There are several things that they had to be. One was literate, okay, or to somewhat literate, because to learn medicine, they had to read the books of the doctors that they were apprenticed to. I've seen this several times. 3 comments were made that made it 3 or 4 comments were made that made it very attractive to make you as a physician. One was to have a quiet voice. One was to have a warm smile. And another was to have a soft touch. The 4th was you needed to be able to grow whiskers, because whiskers suggested maturity. These doctors practiced heroic medicine. They bled people, they sucked out poisons, they caused people to vomit, and they caused people to have diarrhea, to clean out the systems in account with the system of humoral balance. The illnesses that they faced were kind of dreadful, and they didn't have a lot to do. One of the things that we look back on now and grimace about is their use of mercury. They used a lot of mercury, and it could make people really, really sick. A few people from that first half of the 19th century. One is a fellow named Lorenzo Gibson. I don't know if Frank Thibault is in the audience tonight, but Lorenzo Gibson came to Little Rock and Scott in 1833. Frank says that his family has had a doctor in Arkansas since before Arkansas was a state. Lorenzo Gibson and Frank Thibault can count in direct lineage their family all the way to the present of having a continuous doctor in the state. Very interesting thing to me. Nathan Smith was from Old Washington. Nathan Smith came to Arkansas in about the same time frame as Dr. Gibson. He was a scientist. He was called the weatherman. And for 25 to 30 years, in addition to practicing medicine, Nathan Smith recorded the temperature, the barometer readings, the humidity readings, and the overall weather. When the federal government began to get ready to produce the National Weather Bureau, they used his records as a part and parcel of setting the changes in climate back to that time. Dr. Charles McDermott was an interesting and rather irascible fellow who came to Arkansas, came to Bend, Arkansas. Bend was a little community on Bartholomew in the southeast part of the state. Dr. McDermott was an inventor. He had held patents for a number of things. One of the things he did was build a 9-wing airplane. That 9-wing airplane can still be seen in a small museum in downtown Dermont, because when Dr. McDermott died, they named the town Bend. They changed it to Dermont. Dr. James Debrell was one of those elegant, elevated men who happened to be who showed up in Van Buren, Arkansas in the late 1830s, early 1940s. He started the first medical society in Arkansas. It didn't survive, but he was truly beloved by that part of the state. Next slide, please. The germ theory had been a long time in coming, but during the Civil War, Lister and Pasteur were working on developing a coherent therapy of the causes of these diseases. They didn't believe the old business of the humoral therapies. And by the time of the end of the Civil War and the first part of the 1870s, the germ theory was beginning to be accepted by the scientific community. Now, part of the problem with that is that with all major discoveries and major dramatic changes, there's always a dramatic information float time. And back in those days, the information float time is the amount of time it takes for something to be discovered, validated, disseminated, and incorporated. Back in those days, a major discovery might take a generation or two of physicians to be established. And that was true in Arkansas. The germ theory wasn't really well established until the 1880s and 1890s. Most all of medicine in that day was practiced by horse. There were no all-weather roads, and in fact, in many areas, there were no roads at all. The Civil War and the time after the Civil War resulted in a number of new technologies that had not been noted before that. One of those was the stethoscope. Stethoscope was probably was invented in 1814, but it did not have widespread use in the country until the post-Civil War era. The hypodermic syringe with a needle first had its introduction to rural medicine in Arkansas in the 1870s. Dr. Kennery from Oiltrough, and another doctor that many of you might be familiar with, or you're familiar with his last name, was a Dr. Thomas Ackerman, who came to Cleveland County and Rising in the 1870s from Vanderbilt and introduced the syringe. For those in medicine, I think you already know where I'm going with this. For those not in medicine, his grandson, Dr. George Ackerman, has taught many of the country doctors of Arkansas for several generations, and he just died a couple of years ago. In terms of the cost of medicine, in 1860, the cost for an office visit in the country in Arkansas was $1 for an office visit, $2 for a house call, and $3 for a night call. In 1960, that was still $2 to $3 for an office call, $4 for a house call, $5 for a night call. In 1970, an office call was $10 to $15, and a house call was $20. So, and obviously, what happened with that was Medicare and insurance. What happened there? Next slide, please. There was a degree of professionalism that began in the late 19th century with the development of medical societies and the development of improving education, so that instead of somebody being apprenticing to another physician and then taking a 2-month course, they started having medical schools developed during this period of time. And next slide, please. Prior to the Civil War, there were no African Americans in American medicine per se. After the Civil War, there were 7 African American medical schools that were created, and one of those, Meharry out of Nashville, produced most of the African American doctors who came to Arkansas starting in the 1870s. There was a significant community in Little Rock. There was a significant community in Jackson County near Newport, and there was a significant county in Helena, and some African American physicians in Pine Bluff. Next slide, please. There were no women. I'm sorry. There were. I wish I could say this isn't true, but there really were no women in medicine. The first reference I can find to a woman in medicine was a Dr. J.T. Holton, a female who set up her practice for OBGYN in Little Rock. But the one person who had the biggest impact on females in medicine in the last part of the 19th century, early part of the 20th century, was Ida Jo Brooks. Delightful, wonderful woman, just really, she was a pediatrician, she was a psychiatrist, she had been turned down by the medical center to go to school, but she went off to Boston and got her education and came back. And the many women, including Annie Shelton, followed after her. Next slide, please. The technologies began to emerge, the stethoscope, the syringe, but there were a couple of things that changed the nature of practice. The office up to that point was an afterthought. It was a place where you stored records. It was a place where you kept accounting stuff and extra supplies. But the advent of the microscope, the advent of the X-ray machine, all which required electricity and sterilizers, caused physicians to start focusing on developing offices. And this occurred in the late 19th century, early 20th century. Next slide, please. Another thing that has had an impact, or had a dramatic impact in the 19th century on healthcare, was transportation. Almost all medicine was practiced from the back of a horse or a buggy. by the late 19th century, trains had begun to create a web of a spider's web of tracks across the state, and those were beginning use. At the beginning of the 20th century, there simply weren't any cars in Arkansas, and there weren't any all-weather roads. If you were going to use a road, you probably had to use it between June and October when it was dry-ish. Okay, next slide, please. The early 20th century saw several really important physicians who just did a yeoman's job. But I'd like to focus your attention on the gentleman in the left upper hand corner of the slide. That was Dr. C.E. Dash, and by 1898, he was getting older. It was on the anniversary of his 78th birthday. He wrote this poem to the Arkansas Medical Society and presented it there. And he said, "To tell of the wonderful things of late, to tell you must a pessimist be, for they look after things much less than a flea. A germ is found for everything, and you must believe it or take the sting of the scientific scourge that comes with the ring." Dr. Nash was reflecting what I was saying earlier about the information flow time. It had been slow to get there, but it was beginning to get there. Leonidas Kirby in the middle upper part of this slide was a wonderful, delightful man who much has been written about him, and he is a very delightful fellow. From Harrison, Arkansas. He came there in the 1870s. He died in the 1820s, and he was just a delightful person. Dr. T.E. Ryan down in Thornton, that's the guy in the lower, was another one of these men who became a staple of the community. He was a hidden gem, and people recognized him for what he was. In the right upper hand corner, you'll see Dr. John William Morris. Dr. Morris was born in 1875, went to medical school, came back to DeView. He was from Searcy, came back to DeView, Arkansas, south of McCrory. When the train came through, he moved to McCrory because that's where the train went. He practiced for 85 years, I believe. Not 85, but 80 years. On his 100th birthday in 1975, the town of McCrory threw a massive party for him. And the next day he went back to his office and saw 25 patients. He was a stable part of that community. Dr. R.B. Robbins had a major impact on medicine as was practiced around Camden. He was a facile surgeon. He was there when people needed him, but he was also a medical politician. He is one of the men in 1948 he and Font Richardson helped to establish the Arkansas Academy of General Practice, which was the forerunner of the Academy of Family Physicians. Okay, next slide, please. The modern age of country doctors probably started in the post-World War II era. The first half of the 20th century had not been good for Arkansas. Boll weevils have destroyed many cotton crops. Natural disasters like floods in 1912, 1927, 1937, and the mechanization of the farm caused people to begin to leave the farms and then ultimately to begin to leave the small towns. And that began to reduce support all over. World War II aggravated that process because many of the young men who left for the war did not come back. Many of the young women who worked in munitions factories, and there were 5 or 6 large munition factories in Arkansas, did not go back to the small towns. In 1948, Dr. Jerry Coddington at the University of Arkansas did a study where he looked at the numbers of physicians, pharmacists, and dentists and the state of hospital care in Arkansas. And what he discovered was they were woefully inadequate. There were fewer and fewer doctors per population, and the ones who were there were much older. One of the things that was clear then and is clear now, older doctors see about 1/3 as many patients as younger doctors do. the state began to be further proactive at that point, passed the People's Act, which funded scholarships for physicians who wanted to go back to smaller towns. This really didn't happen very well and didn't work very well. And it didn't really materialize until the 1970s with the development of the AHEC programs. In the 1950s, there still were only about 6% of the physicians in the United States were female, and less than 3% were physicians of color. Next slide, please. Another thing that changed medicine dramatically, and it's hard for us to envision how important this was, but another thing that changed things dramatically was the invention and the utilization of penicillin. Penicillin was made available to the general population in 1946. And it may be an apocryphal story, but there is a story that says that by 1950, 75% of all office visits ended in a shot of penicillin. But this did change things. In 1945, 1 in 4 people who got pneumonia died. The people who didn't die were invalids for a year, and it took a long time to recuperate. Next slide. Two other things that had a big impact. The Hill-Burton Act in the late 1940s, which was similar to what Dr. Coddington did, funded small hospitals in rural communities across the United States. One of the first of those built in this area was the Crittenden County Hospital in West Memphis. But it also, by the late 50s, early 60s, they started funding nursing care facilities for the elderly who could not survive on their own. Next slide. There was a tremendous injection of money into medicine starting after World War II. Private insurance became much, much more common. By 1965, Medicare, Medicaid were passed, and money began to pour into medicine. The available technologies, partly because of the space program, but partly just because of money, just mushroomed in this time era. Office laboratories, imaging, okay, and the cost of this mushroomed as well. Up to that point, solo practices had been the rule. After that point, solo practices began to form into 2 or 3, and then into groups, and then vertically integrated with these small hospitals out in the state. And then with that, the corporatization of medicine began. Okay, ready, next slide. When you look at this slide, I've chose these people because most of these, well, all of these folks are people we've interviewed over the last few years. You will notice that there are at least 2 women in this slide and 4 men, and mostly are young people. Okay, there are 2 African Americans and 1 Puerto Rican in this picture. It's interesting that these folks are now quickly becoming the face of country doctors. They are, and I want to particularly spend a little time talking about the 2 folks in the left lower hand corner, Dr. Susan Ward Jones and Dr. Steve Collier, because I think both of these folks need awards. After the Great Society program, they created the community health programs and clinics. Those took off in places like Arkansas. Steve Collier now runs, we'll start with Susan. Susan Ward Jones now runs East Arkansas Community Health out of West Memphis. And they have locations out in many of the smaller towns in her community. She's originally born and raised in Helena. Steve Collier was born and raised in Augusta, went back there in the 80s and took what was White River Rural Health and created created RCare. They are now in 25 counties in the state of Arkansas. They have 25 to 30 physicians who work for them in small towns in rural areas that no one else wants to deal with, okay? And they have 25 to 30 nurse practitioners. We'll talk about that just a little bit. The nurse practitioners, physician's assistants, and now osteopaths, okay, have been filling much of the gap over the last few years where they could not get a doctor to go into the community. And that's what Steve and Susan Moore-Jones and several people down in South Arkansas have been working on, okay? So, next slide, please. Technology has just mushroomed. EMS services did not come along until the 50s and early 60s. And it wasn't until they started being funded by Medicare that they really began to take off. CCUs, in-office laboratories, computers, monitoring at home, all of these things had a big impact on both the patients in the country and the country doctors themselves. Next slide, please. The larger organizations like Baptist Health of Arkansas, Baptist Health of Memphis, St. Bernard's in Jonesboro, Mercy and St. Edward's in Fort Smith, Washington General in Northwest have really played a significant role in providing care out in the country as well, and will in the future. Okay, next slide, please. With the beginning of the 21st century, technology has made its transition from tertiary hospitals in the big cities to small hospitals to doctors' offices. I would suspect that there are a number of people in this audience who, during the COVID, have, if you look at that bottom slide is telemedicine, who have gone to their country doctor, have gone to their doctor via the internet, okay? Medical records play a big role as well. Next slide, please. So where are we going? Where do we go from here? Well, Dr. George Ackerman, back to George again, who taught several generations of country doctors in Arkansas, said, "I have been in this business for many years, and one thing remains constant. The questions of medicine never change. It's just the answers. Things we are doing now, 20 years from now, may be looked on as complete heresy, but we are doing the best we can at the time with the knowledge that we have." My contention is, as long as there are people living in the country, there will be country doctors. I don't know what kind of initials they will have behind their name, okay? But we humans come along and occupy a place in society for a few decades. Then we step aside and someone else takes our place. I can't help but wonder who will take the place of the present country doctors of Arkansas. Thank you. I'm through, Tim.
Okay, thank you, Sam. Let's open up the chat for questions. And if you have any questions, please feel free to use the chat box. And I will, Sam should be able to see it, but I'll read the questions out loud in case people have trouble seeing it.
Tim, are you talking? Because I can't hear a word.
I am talking, yes.
I can't hear a word. I assume y'all can still hear me, okay?
Yes,
but I don't know when Dr. Brooks practiced in Little Rock.
You're talking about Dr. Ida Jo Brooks? Is that who you're talking about, Bill?
Thank you.
Ida Jo Brooks actually she became the first female faculty member at UAMS in 1912, I believe, 1912, 1914. And so she practiced in Little Rock around 1906, in the early 1900s.
Ms. Russell, I think the yes, I think that the reason for trepanation. And I take that back out there, please.
You got it.
Yeah, just a little. I think the reason for trepanation was probably initially had to do with someone would have a head injury, okay, would have a head injury, and they were trying to release pressure, okay. But I've seen, and it's often said, the speculation is often that it was either let something in or let something out, okay. And that's about as far as I've been able to see. Thank you, sir. Okay. Sorry about the confusion with the muting. I'm not sure what's happening there.
I'm not sure if Sam can see the questions, the rest of the questions, but I will forward those questions to him, and I will send it out to the people who have participated.
I'll be right back. And Dad, bring me that telephone in here.
Sorry for the audio problems.
Sorry.
We got this here. You got this.
Sam, can you see the questions on the screen?
Yeah, I was seeing some of the questions.
You got feedback.
Get too close.
I'll stay over here.
Okay. Herb Lundy. Thanks, Herb. Yeah, I am seeing the questions.
So the Dr. Dibble from Van Buren, his son was in Little Rock.
Yes. Yes, he was. There were actually several. There were several Dibbles. There were several Dibbles who participated in the medical school and the founding and were on the staff of the medical school. And there, by the way, this is another one of those families with one of those prolonged histories, because up until about 5 years ago, there was a very young Dibble who was working in Heber Springs. He moved off to Parris Island, Tennessee, I believe.
And I think the last question was, Sam, where did students in the Mid-South go to study medicine in the mid to late 1960s?
Oh, I know what you're talking about that. Okay, I was going to talk about that. I didn't want to run Tim over. That was an anesthesia mask, okay? Anesthesia didn't really have didn't really start to be a real thing until the 1840s, 1850s, and 1860s. But it changed surgery as was performed in the home, because there was a lot of surgery that was performed in the home where people couldn't get anywhere to get their surgery. And so anesthesia changed it so that by the beginning of the 20th century, the important elements were hemostasis, that is stop bleeding. 2, antisepsis, stop infection, okay? And 3, middle block. 3, okay. Oh, gentleness with tissue, okay? Because before that, they would just rip, snort, go through there and cut out what they could and then not worry about it, okay? But after that, anesthesia changed surgery. By the way, if you want to read a really good piece about kitchen table surgery in Arkansas, Taylor Pruitt from Fort Smith published a couple of articles several years ago in the one of the Fort Smith journals, historical journals, really excellent piece on tabletop surgery, or kitchen tabletop surgery.
Okay, if we don't have any other questions, we'll let you go. Thank you all for attending tonight. We'll hopefully see you on July 16th. Our next stay-at-home lecture presentation will be on Dr. Edith Irby Jones. Sam, thank you very much for being here tonight, and we'll look forward to hearing you again sometime in the future.
Great job, Sam.
Bye, Becky.